Hey there, my friend. What brings you into my office today? Think you're suffering from a cold? Well, I hate to hear that. I'll take a good look for you, though, and we'll get you feeling, hopefully, by the time you get out of here, brand new. Sound good? Perfect. Okay. Well, my name's Dr. Cap, and I'll be your doctor today. When and about did you start feeling bad? Okay. Yeah. Well, again, I hate to hear that. So, to get started with this exam, diagnose what's going on with those symptoms, I do want to get a baseline reading on your overall health. With that, I want to listen to your heart, as well as your lung capacity and how you sound in your chest. So, I'm going to go ahead and throw my stethoscope on, and we'll just go ahead and get started on that. Sound good? Good, okay. All right, my friend. Just going to set this right here on your chest. And we're going to take a quick listen to your heart, so just relax for me. Good. Your heart sounds wonderful. Nothing to be concerned about at all there. That's good. Now we're going to get a quick listen to your lungs. So I'm going to be moving my stethoscope around. I'm actually going to go up the front of your shirt here, if that's okay with you. Good, okay. Just follow my directions. All right, so going up, 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 up. And give me a deep breath in through your nose. Good, and exhale. Good job, my friend. Good. All right, move it over here. Deep breath through your nose. And through your mouth. Good. Over here to the right side. Deep breath in. And out. Good. And over here to the left side. Deep breath in. And out. Good job. Good, good, good. Okay. Well, your lungs sound good and healthy, so that's a good sign. A lot of times, if we are suffering from sinus infections such as strep throat or anything like that, that can be a little bit struggle for patients to get deep breaths, so no concern there. As far as everything else with your health, have you been feeling okay besides for this cold? Yeah, okay, good. Well, to get started, what I want to do is have you open your mouth. I'm just going to glance in, okay? Perfect, all right. To do this, I'm going to use my ophthalmoscope. And I've got a specialized tip that's going to allow me to look to the back of your throat, okay? So, if you could for me, just open your mouth wide, say, ah, stick your tongue out, ah, like that. Perfect. And I'm going to go ahead and take a quick look, okay? Good. Just keep that mouth open for me. Good. And so far, everything is looking fantastic. Might be a little bit of redness going on towards the back. Now, I'll ask you, have you been coughing quite a bit? You have? Okay. And as far as your sleep pattern goes, have you noticed any disruption in your sleep pattern? Less sleep than usual, more sleep than usual? Okay. All right. So, that can mean that you're a little bit dehydrated. So continue to drink water throughout this for sure. But also want to ask, when you wake up in the morning, do you notice that your lungs are more full of phlegm than they are when you go to sleep? Okay. All right. Well, I do want to do a quick strep throat test, which is going to require me to get a swab at the back of your throat. Then we'll send it off to the lab, all while you're here, obviously, and get results back. I want to rule that out. And if it's not strep and we figure out that it's just a common cold, I can prescribe you a little bit of over-the-counter Claritin, and that should help clear that up for you. But I do want to take a closer look at your throat, okay? So what I'm going to do here is put on a pair of gloves. And I'm just going to kind of touch around your face, your neck area, just to see if you have any issues there, any discomfort, any swelling, particularly with your lymph nodes and your neck area. Swollen lymph nodes can mean that you're fighting off an infection of some sort. So that'll give me a hint as to what may or may not be going on. Okay. Good. Besides for this, has everything been okay with you in your life? Everything's going okay? Good. I like to hear that. I like to hear that. Okay, my friend. So I have here in my pocket a little flashlight. I'm just going to have you open your mouth one more time, okay? And I'm going to get a little bit closer with the light just to really look in the back of your throat a little better, okay? Perfect. All right. So open up for me. Good. Yeah, I know it's a little bit brighter, but you're doing a good job. Keep up the good work. Very good. Yeah, go ahead and keep that tongue out for me. Fantastic. Good work. It's definitely a little bit red, okay? Let me feel around your neck area here. And any of that feel uncomfortable to you to touch? Not too bad, okay. All right. So, your lymph nodes are a little bit swollen. Don't be too worried. We haven't figured much out yet, but that does tell me that, it gives me a little more confidence in administering a strep throat test. So, and I know they're not very comfortable. It's going to require a throat swab, and it might activate your gag reflexes, but it's the price we pay for being sick. So I'll make it as painless as possible for you. How about that? So what I do want to do is have a closer look here at the back of your throat. I'm going to decompress your tongue here with this device, okay? It's a tongue compressor. It's been sterilized and new tip on it, so don't worry. But I'm going to just press your tongue down, so open up your mouth for me. I'm going to take another look, okay? Good, all right. So open up. Good. Just like that. And good. Yeah, it's definitely a little more red there towards the very back of your throat. So it could be strep. It could be from just you coughing a lot with the cold. So don't worry, we'll get it figured out, okay? Now, got some cotton swabs here, okay? And what I'm going to do with these is just swab the back of your throat, okay? And we're going to get a saliva sample there from the back of your throat. And when we send that back to the lab, we'll be able to put that under the glass and figure out if it is indeed strep throat. Okay. All right, my friend. So, open up that mouth again for me, really wide. Okay. I'm just going to compress your tongue here, and I'm just going to get a quick sample. Sound good? All right. All right, open up, up. And just like that. And we'll place this in my test tube here. And send that back to the lab. Okay. All right, good deal. Now, as far as overall health goes, you haven't really been noticing anything else that might be bothering you. Very stuffy nose. Sure. Do you think there's any blockages occurring at all? Okay. Do you feel like it's more towards the sinuses or towards the front of the nasal cavity? Interesting. Okay. More towards the front. Okay. Well, we'll take a quick look at that while we're waiting on your lab results, okay? Good. All right. Again, what I'm going to do is get our ophthalmoscope here. Turn that on. Now I need you to lift your head for me like so. And I'm going to gently pull your nose up and take a look here with this slide. Sound good? Good. All right. Go ahead and tilt that nose up. I'm going to grab your nose for you, if you don't mind. Good. And we're just going to take a look here. Yeah, your nasal cavity's a little swollen as well, so. Interesting. Have you had an allergy test lately? You haven't? Okay. Well, the reason I ask is with the symptoms of your coughing and whatnot, while I do think it is either A, strep, or B, common cold, that coupled with the swollen nasal cavity tells me that you might also be experiencing slight allergies, which can, swell up our faces, close our nasal cavities in that regard. So, are there any things that you are allergic of that you're aware of? Okay, all right. So, some peanut allergies, lactose intolerant, grass allergies. Okay, wow. Yeah, you got quite a few. So, that's what it could be is an allergy. We could do an allergy test on you, but maybe we'll hold off on that. You can't think of anything else you might have eaten that might have caused this? Gotcha. So you had some whole grain bread earlier. Well, there can be nuts and stuff in that. If you're not deathly allergic to it, then that would explain why your nose might be closing up on you. Your throat might be a little achy. Yeah. Okay, my friend, well, I have some throat drops here. And they're very good. They come in a spray form, as well as a dropper form. I prefer the dropper form. It seems to be a slightly more concentrated product. And I also find it can be more effective for the patient to get it salivated throughout their mouth before they swallow, and it really helps to coat the area in the mouth versus me just spraying them, spray to the back of the throat. So I'm going to have you open up. I'm going to give you a couple drops of this. It's going to help to deaden some of that pain, that soreness in the back of your throat. Okay? Good. All right. Go ahead and open the top on this. We're going to get a little bit here in our vial, just like so. And, all right, open up wide for me. Good. 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 Good, good, good. Okay. Now don't swallow it all the way yet. Allow it to disperse throughout your mouth. You're going to do like a camel. Yeah. Then swallow it. It's not bad, is it? Yeah, it's got a bubblegum flavor. Okay, well, as far as your throat goes, usually takes only a few seconds to feel the effects of the medicine. Are you already feeling a little better? Try swallowing for me. Feeling better already? Good. I like to hear that. I'll write you a prescription of that. I don't know how long your throat might be hurting for, so that's a great product, and I really highly recommend it. So, I'm take a note here on my pad just to get you a script of that. Beautiful. Okay. And it looks like we have gotten our test results back from the lab. So let me take a look at that real quick. Well, I have some good news and I have some bad news. Which one do you want to hear first? Okay, the good news is you don't have strep throat. All right? Bad news is you still have a cold. Or allergies. But regardless, it's not going to require us to give you any antibiotics. So that's always good. So, with that said, I'll write you a prescription for a common Z-Pack, Claritin. And over the course of the next week or so, you'll just take as prescribed, and that should really knock out this cold, and you'll be back to feeling like yourself in no time. In the interim, I also wrote you a prescription for the drops, so you're going to want to use those as prescribed as well. Do me a favor, okay? Be more mindful of what you're consuming given your allergies, okay? Yeah, I don't want you having to come in here and get a shot to open up your lungs or anything like that, okay? Back of your throat. So, just be mindful of what you consume, okay? And as far as the exam goes, I think we have it figured out. And is there any questions you have for me? No? Okay, good. Well, if I could recommend anything, I would say be mindful of how much water you're consuming. You're going to need to consume more water, more likely. It's going to help flush this out of your system a little quicker. And try to get some more sleep, because sleep, is great to aid our body in fighting off bacteria. So, but as far as that goes, it doesn't seem like there's anything else that we have to worry about. So, I'm very glad we were able to get that taken care of for you. Well, don't mention it. It's part of my job. Yeah. So, you have my contact. If there's anything else you need, or if you get to feeling any worse, please feel free to contact me. We'll get you back in here, okay? Perfect. All right, my friend. We'll see you next time. All right, bye.